Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. We're getting a lot of questions about a couple of viruses I'm going to touch on briefly today. The first, of course, is the Delta variant of the SARS-CoV-2 virus. And the second one I want to touch on today is West Nile virus. So questions about Delta, the Delta variant of COVID. It is concerning to us that we continue to see these variants develop. It's not surprising to us. That's what viruses do, especially an RNA-based virus like COVID is. The challenge with this Delta variant is that it is the most contagious variant that we've seen thus far. It's 2 to 3 times more contagious than the original coronavirus that we saw. What's concerning to us beyond that is that we still have about a third of our population that is electing not to get vaccinated, of our eligible population that's choosing not to do that. When we hear from them what their reasons are, a lot of their reasons are based in poor information, including this idea that people don't want to be a guinea pig or a test subject for a new experimental drug like these vaccines. And the reality is that these vaccines have been tested extensively, and research on them began almost 20 years ago when SARS was first identified back in the early 2000s. The vaccines, while no product is ever 100% entirely risk-free, they are incredibly safe. The rate of side effects is extraordinarily low. These vaccines are among the safest of all products out there. Some people have said they don't want to be a guinea pig. Well, in reality, what's happening currently is that those people who are unvaccinated, who are choosing to be unvaccinated, they have become a gigantic testing ground. They have become a laboratory for the virus itself to mutate, to develop new strains. And right now, while we're thankful that these new strains are still controlled very well by the vaccine, the reality is that if these things continue to mutate, we could see variant strains that are more dangerous to us or perhaps to children, have more severe consequences associated with them. So I can't underscore enough how important it is in this moment that we get vaccinated, that we make sure we get that coverage up so we reduce as much as possible the portion of our community that is acting right now as a testing ground for the virus itself. So that's my thoughts on the Delta variant. Let's make sure we get vaccinated. Let's make sure that we stay strong and stay wise with how we approach COVID. West Nile virus. We received an awful lot of rain over the past few weeks, and of course what happens when we have rain in the summertime in Michigan is we get mosquitoes a few weeks afterwards. And so we're getting lots of questions and concerns about the mosquitoes and the huge population that we have right now. The reality is that the mosquitoes we're seeing right now are a lower risk for West Nile virus or EEE than the mosquitoes that we see later in the summer. It's a different species of mosquito. These are what we call nuisance floodwater mosquitoes. They emerge when we get these high water levels, and they generally die out within a few weeks. So we expect to see the mosquito numbers die down here pretty quickly. However, as we enter August and September, that's when we tend to see the emergence of mosquitoes that are more concerning for West Nile virus and EEE and other mosquito-borne illnesses. So this is a good time to remind ourselves about the importance of wearing a DEET repellent, being smart about avoiding mosquitoes if we can, being smart about dusk and dawn when mosquitoes are most active. And also, if I can give everyone a little bit of homework, please take a walk around your property where you live about once a week and look for any containers that you may have on your property that hold just even a little bit of water. It doesn't take much water for mosquitoes to lay eggs and to incubate the next generation of mosquitoes. So look for the bird bath, the water bowl for the cat or the dog, if there's any cans in the bushes, children's toys, buckets that may have a little bit of water, dump those things out. By doing that, we can really reduce the number of mosquitoes that we have in the next month or so when we are more concerned about those mosquito-borne illnesses. I want to also encourage you to get outside. We're here in the summertime in Michigan. It's a great time to get outdoors, be active, wear that DEET repellent, wear your sunblock, be smart, but get outside. It's so important for your physical and your mental well-being. Get outdoors, be active, have a great summer, and I'll talk to you again very soon. Thank you.